At our future press briefings, obviously it's going to continue to be all about COVID-19 and our response, but we're also going to, on occasion, since your access to our team has been limited and there were some stories you were following up until this, we're going to bring in a few other people. So one thing in the next couple of days, I want to bring in Julie Smith. She is our Director of Surgical Services, basically runs our ORs at Bryan, to give us an update on our Transforming Surgery project. Other events we had to cancel were for our donors and for our media to unveil the new operating rooms. So we're going to bring Julie here and we'll get you some footage on that. Frankly, it came at a gratuitous time because these new ORs will be open, and then the ones we are vacating that were scheduled for pretty immediate demolition for, repurposing will still be available for us to use in response to COVID. I also want you to hear from Julie too. If you tuned into the governor's press conference yesterday, our CEO of Bryan Health, Russ Gronwald, was speaking about how we modified anesthesia machines into ventilators to add 34 new ventilators to our supply. That was Julie's idea, and now it's being emulated across the state. Another thing that I want to bring forward in the coming days, weeks, is information on our cancer center. The plans for that are moving forward. We want the community to see that we will get through this. We're still looking forward. Teams are working on that. And then obviously you guys can cover it how you choose, but we'll be bringing some of that forward periodically. Before I introduce John, just as we do, the daily stats, the Easy Visit is really taking off. We've had a little over 5,900 that have completed the COVID questionnaire on Easy Visit. That resulted in 1,130 advancing to Easy Visit, the next level, and 493 of those used the promo code. So you do see those numbers growing. It is a key thing that can help get the physician referral for our drive-through clinic. Our daily census is 365, which is a second day of upticks. Not all related to COVID, but I think what that means is there are still sick people, there are still emergent surgeries that need to occur in town, and Bryan and hospitals throughout the state are still there to do the things that hospitals typically do as we prepare for COVID. Tests to date, we have completed 45 tests in-house. 41 of them, thankfully, have come back negative. 4 are pending, and all 4 of those are inpatients. Again, I think another further exhibits of there are a lot of sick people that need care, and collectively, it is so important for us to flatten the curve. A new thing that is coming out today is, or not today, but we're looking at in our incident command is a supply chain deal, and it's kind of like a traditional scorecard. You have red, green, and yellow marking if things are, good, bad, or medium. And I'd say the only thing that was as critical on today's scorecard was disinfectant wipes. There are a couple others where we're teetering on between limited and critical, but a lot of that is in response to the tremendous response from the community for some things. So anyway, as we wait for the national and international supply chains to get more reliable, I can't stress how the community has helped bridge us a gap to that, and more to come on that in future days. With that, that's enough from me. I'll turn it over to John, and then we'll follow up with questions and answers.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center. I, too, want to just thank the media for this coverage. I want to tell you our drive-through clinic yesterday was a success because through your communication, the public followed the guidelines, and that is so important. So from a traffic flow perspective, people came there that already had been screened by a physician, and we had an order for them. We only had a couple people arrive that did not, and we were able to have them go to our urgent care center. I want to thank the police department. They did an absolutely outstanding job directing traffic. It made the flow go well. So to just give you some statistics, we had 60 slots available. We had 59 people scheduled. 5 people were no-shows. That typically happens when anybody schedules for procedures. We had 0 of those tests come back positive for influenza, so those were all negative. Then people move up to what we call the respiratory pathogen panel. We had 4 positives there, so those people were given their instructions. So 50 tests will be moved on for the COVID testing. One of the things that we've realized, now it's only been 1 day, but we've seen a tremendous drop in influenza. You know, last week we were probably in the 50s for the organization. So to see that we tested 54 people and we're at 0 is probably giving us a sign that the social distancing is working and it's having an impact. So we will continue to monitor this. We've only had 1 day now of doing this, but if we start to see that we're at 0 for the influenza, we will probably stop that test as part of the testing. So one less spot where people have to go through and have a test done. I also want to say that we're going to be looking at volume, so we will be assessing that constantly. It's part of what we do. We'll be looking at the demand to determine if we need to extend hours or do something different to help with the flow of people. But as of now, we handled yesterday well. Today, of the 60 slots, we have 35 scheduled patients. That will increase throughout the morning because a lot of people are being screened either with their physician or through the Easy Visit, and those calls will come into our scheduling center. I also just wanted to comment that we are in close contact with the health department, and I know there's rumors that spread. Your source of truth on positives in our community is the health department. We are in close contact. If we would have any positive, they're going to be the first group to know, and they will be the ones communicating that out. So when you hear from other people about positives happening in other areas, your source of truth is really the health department. So I just encourage people to get your information about positives from them, or you will hear us repeating what we get from the health department. Once again, want to thank the public for following the guidelines. It's what's making this successful, that we're able to take care of people in a timely fashion. And with that, I would open it up to any questions that they may have through chat. The first thing we do is an influenza test. If that comes back negative, then they go and have what we call a respiratory pathogen panel. When we're taking that swab at that point in time, we have collected what we need for the COVID test. So what happens is we have about a 24-hour period to get back to individuals. We were able to get back to people and tell them if their respiratory panel came up negative. If it did, then today we're sending out all of those for COVID testing, so people don't need to come back. You will probably see the same thing that's happening in this community. A majority of them will probably come back negative. In fact, a very high percentage will come back negative. So that will tell us that people just have a respiratory type infection and it's not anything really major. A lot of this is very mild type symptoms. We didn't have anybody that we needed to hospitalize, and typically those individuals we would recognize right away, and those are the people that are having the breathing issues, fevers for multiple days that are probably coming directly to our emergency room. They say that if an individual is exposed, basically they will see symptoms in about 5 to 12 days. That's why they look for the quarantine. If you feel you've been exposed to a COVID-19 patient, the best thing to do is quarantine for that 14 days to see if you see any of those symptoms start to emerge. Honestly, from what we've been seeing, I think you're just going to see a majority of negatives come across. I would honestly be surprised if we see a positive occur. But once again, that will all be communicated through our health department.
Frankly, the bed space with conversion that we can do to the rooms might not be as pressing as the supplies and equipment shortages, because and you can see it in the very sad imagery and news that's coming from throughout the country, that as the disease progresses for those that are most vulnerable, it requires ventilators and so forth, and there is an extreme shortage in the country. So flattening the curve is vitally important here in Nebraska. the response was really, really overwhelming, humbling, and all of that. Again, what that's allowing us to do is really bridge the gap until the international and national supply chains get fixed.